Parents of newborn infants have been asking me questions as to how common hip instability and dislocations are in babies and how they can recognize this problem. Well, let me make sure everyone is hip to knowing about this problem and provide some information on the topic. Hip instability, which can lead to dislocation, is a deformity of the hip joint that can happen before, during, or even weeks after birth. In most babies, the hip joint consists of what looks like a ball at the end of the long thigh bone of the leg called the femur that sits comfortably in a socket or pocket in the pelvic bone. However, sometimes the ball part of the femur moves back and forth and comes out of that socket, making the hip slightly unstable. And if it slips out completely, then the hip is said to be dislocated. So what causes this problem? We aren't sure, but several factors may be playing a role, including a family history of others having this problem, a baby being cramped in the uterus, being born in a breech position, swaddled too tightly, or even a mother's hormones during pregnancy, which make the ligaments or bands holding the hip joint together relax, resulting in joint instability. Since a hip dislocation is not painful, how can you tell if it's occurred to your baby? Well, or perhaps to this toy bear. If there's an asymmetry in the folds or creases, basically in the groin or the buttocks, or if, as your baby's hips are examined by his or her healthcare professional, there is limited range of motion of the hip, of one hip relative to another, or a clunk is heard in moving the hip back and forth during the exam, it may also signify instability and or dislocation and a need to confirm the diagnosis with a hip ultrasound imaging study. If hip instability is detected, your child's doctor will have a pediatric bone specialist check the hip out as well. Sometimes mild instability gets better by itself, but commonly infants will usually be placed in a type of harness for 6 to 12 weeks that keeps the ball of the femur in that socket until the hip joint ligaments have become stronger to keep it from slipping out. If the problem is not recognized for months, well, the harness will no longer work and surgery may be indicated to prevent complications like different leg lengths or a limp when walking starts. The good news is that developmental hip instability or dislocation, if treated early, results in your infant walking normally, usually by a year of age, with no delay in their motor skills. So that hopefully tips like this will stabilize your thinking when it comes to knowing more about what to do if you think your child's hip is unstable or dislocated. This is pediatrician Dr. Lewis First from the University of Vermont Children's Hospital, reminding you to always be what? First with your kids.